Hello and thanks for joining us on this women program dubbed Inclusivity for Women and Girls. My name is Juliet Mutale. Now this is a program that highlights many success stories of the many women in Zambia, in this country. Now today, to give us more information, to give us more highlights, is Dr. Gertrude Tshuma, a retired gynecologist. Doctor, welcome to the program.
Thank you so much, and thank you for having me.
Great. Yeah. Now we're heading towards the commemoration of International Women's Day, which falls on the 8th of March. We're talking about Sunday, this Sunday. How does that make you feel?
It makes me feel very good.
Great.
Yeah, it does. You know, being a woman is very special.
Great. Yeah. Now this year's theme is rights, justice, action for all women and girls. How do you really interpret this theme?
Yeah, so people can interpret this theme differently based on their backgrounds. Yeah, so from my background, basically, I think that women have certain entitlements, and those are rights, and no one can take away those rights, and therefore the entire community must rally behind a woman and be able to support the woman. Justice, yes, there is need for equity, and there is need for fairness in the way that everything is done around according opportunities to men and women. It's very important that society recognizes that women and girls are the backbone of this nation, and that opportunity given to them can change a nation, can transform a nation.
Great.
Yeah.
Now, this year's special day, Women's Day, focuses on rights, justice, and action. Really, in your view, what does reproductive justice truly mean for women and girls today?
You know, Juliet, there is no nation without a woman. I think, like I have already alluded. And therefore, there's a lot that women do, which requires the fact that they should enjoy a just environment, and an environment where they can express their full potential. Yeah, so reproductive, yes, because I mean, we are the ones who feel the earth. We've been commanded to feel the earth, and at the end of the day, a woman needs to be given access to very good quality health care. They should be able to prevent unnecessary disease that can easily shorten their life, and for them to take care of that family, they need to be in a health condition that you know, gives them that opportunity to serve the nation better and their families. And so justice is important, reproductive justice, so that, you know, when a woman, for instance, goes into labor, everything should have already been set for that woman. They don't have to suffer to get to the hospital to go and give birth. And the entire system, the community, the healthcare system should be supportive enough for this woman who is going to give birth. And in between pregnancies, of course, there are other issues that need to be dealt with. They must remain healthy. They must not die from a disease that is preventable. Yeah. So I think for me, that's what I would say.
Now, looking back, Doc, there were moments probably in your career where you witnessed injustice when it comes to women and health care. Yeah. And really, how did you respond to this?
Yeah, I think we are all advocates. We are all supposed to be advocates of justice. And in the healthcare system, as a healthcare practitioner, it's our responsibility, because we are the ones who see what happens to women. We are the carers that should be we are the first line, basically, that are in contact with patients. And therefore, when injustices are taking place, we must speak out. we must speak out. I had a privilege to, for instance, head the department. I was the first head of department for the Now Women and Newborn Hospital. And there are a number of things there that I tried to do to change the scenario. I'll give you an example. There was a lot of delay in conducting cesarean sections, emergency cesarean sections. And we lost a lot of women as a result of that, because the theater was very far. When you make a decision and this woman has to be wheeled to a very far off place, by the time you are getting there, every second matters, and you would have lost that woman. Yeah, so I advocated for a theater to be within labor ward, so that once a decision is made, it's just a step away and the cesarean section is performed. And today I think the women of within Lusaka here are enjoying that facility. Yeah, I advocated for a referral system that is very helpful. Yeah, so I at some point developed even an electronic system that could help this nation in terms of quick referrals and avoiding unnecessary delays as we refer these patients. So that's just, I can go on and on. It's a long list. Yeah, the other one I think is has to do with the way we conduct operations. Yeah, the way we conduct operations on women. Mostly we make these cuts. We call it Cape to Cairo, meaning from Cape Town to Cairo, Egypt. To Cairo, Egypt. So it starts from there and then goes all the way down. Yeah, so of course we changed at some point and we do a smiling kind of operation. But there are better options, really, honestly. And, you know, it's the likes of laparoscopy, which is keyhole surgery. I think I was one of those that really pushed that agenda. I sponsored myself, went to Germany, did some bit of training there on laparoscopy. Believe you me, if you went there, you found no woman who was having the kind of cuts that we have here to do surgery. All the patients that I saw there, apart from those ones who were delivering babies, they didn't have that kind of cut. They had keyhole surgery. So what it leaves you with is a small cut on the tummy. So maybe you might have a very small cut, like keyhole kind of cut, you know, maybe 3 of them on the tummy.
Wow.
Yeah, and I started advocating for, there's another procedure which is ultrasound wave based. It didn't materialize, but my prayer really is that somehow that may be pursued and it comes. So what that does is that it produces these ultrasound waves, and the woman is just lying there like they are doing a CT scan, and these waves just go there and they dissolve these fibroids. Even it can even be used for cancer. It can be even used beyond women. It can also be used for men for certain conditions, including cancers. Yeah, so in a country, for instance, here where we do not have a consistent provision of radiotherapy, for instance, that would be another alternative. You know, and those are, the investment is big, yes, but I think it's worth pursuing. Yeah.
So those alternatives you're talking about can still be improvised.
Yeah.
I don't know how we can bring them back.
Yeah.
But being a specialist in gynecology, in that health sector, what do you think really government should do? Because I think healthcare for women, I want to say it's a corporate responsibility, but obviously government is at the top there.
Yeah.
What do you think government should do to ensure that women continue to enjoy their health care?
Yeah.
They continue to enjoy their health rights?
Yeah. I think we can talk here. You know, the key issue is to really reduce maternal mortality. Yeah, that has been at the center of discussion everywhere you go in every country. And the government, I must say, the different governments have had their own input, and they have done the best that they can. But there's still a lot that could be done. Yeah, there's still a lot that could be done. And we have leveraged on partnerships, for instance, to change certain things, to improve family planning, to increase on the number of hospital healthcare facilities. Yeah, that has been done. And I think blood bank services now, there is some improvement in that area as well. There are more, I think, I suppose that there are more opportunities for collection of blood, for instance. Yeah, because why blood? Because blood is very important for reducing that major cause of maternal death, postpartum hemorrhage. Yeah, so most women will bleed because of that. Sometimes they bleed even before they deliver. So there's need for more blood. So if that service, for instance, was to be decentralized, and let's have blood banks in every province, for instance. Yeah, I remember one time I had a case of one of the members of parliament. They had their wife, there was some trouble with that patient out there in, I think it's Muchinga. Yeah, Muchinga province. And I actually had to be flown to there. And before getting there, I had first of all to organize blood here in Lusaka for me to go and sort out a patient who was in Muchinga province. Yeah, so those are some of the few things I think that government can try to sort out. Yeah, Rome was not built in one day. So I suppose that some of those things could be on the table for government to do. Yeah, we thank God for the maternity services in the rural areas, whereby we have now more waiting homes. Yeah, when a woman is about to deliver, at least they can go and sit somewhere and wait for them to deliver. But more is required to be done. Transport, the road networks in those places, accessibility to the health center where they can get help, and even the availability of skilled birth attendants in all these. So we can say so many things. There is so much to talk about. Even this program isn't enough to exhaust some of those things.
Okay.
Yeah.
So let's talk about becoming stronger advocates.
Yeah.
How can healthcare professionals, I know this shouldn't just be left to them, but how can they become stronger advocates for justice and equality within their health system?
Yeah. There are a lot of opportunities for healthcare workers to be of use in our nation in terms of advocating. We already have the systems in place. For instance, we have the Zambia Medical Association, and I commend them for everything that they are doing. And in terms of reproductive issues, we have the Zambia Association of Gynecologists and Obstetricians in this country, where I served actually as a General Secretary and Vice President at one point. That's a very powerful organization that can do advocacy. But however, having said that, I think that as individuals, we can do a lot of advocacy. We can use media. That partnership with media is very powerful. A word moves very fast. And if you like, for me, I think that was one of the motivations for me to retire early. Because I believe that if we went into media, we can do that better. So at the moment, we are talking about a radio station that is getting established. We are crawling, but we are about to stand up. We are about to start running, and people can look out for that radio station. It's a specialized health education radio station, and so that would be a platform for healthcare providers, because they are the ones who are supposed to speak on that platform.
Great.
Yeah.
Now, Doc, I know it's a huge conversation. Would have loved to stay here for an hour, but we're running out of time. Now, as we celebrate the big day, what call to action would you like to share with society to ensure rights, justice, and of course action for all the women and the girls?
For all the women and the girls are in the community.
Wow.
And community needs to rise up to the call to action. There's a lot that community can do at different levels. They can support women, for instance, who are going through health issues, and they can support the girls as well and help them prevent diseases. The men need to be there when women are going through these reproductive issues. Most often you find that the woman is alone, and she has to look for transport on her own going to the hospital when she's in labor. Where was the man to make all those arrangements? So men and boys need to be trained to do some of those things. And community needs to come through. When you can see that there's a woman who is pregnant in the community, but you're not concerned at all. Yeah, and sometimes the woman will be carrying luggage, they will be pregnant and they're walking, and these vehicles are just bypassing. Yeah, so we need to have that soft heart for women. They're very vulnerable, and they need all of us. Yeah, we can advocate and educate them, for instance, on prevention, prevent cancers. Yeah, cancer of the cervix. We can encourage them to go for their routine checkups for breast cancer. Let them live long, because these are the people that really carry the socio-economic status of the nation, Yeah, so I think there's a lot that we can do. There's a lot, like I said, that we can talk about, but save for the time that you're talking about. Would have been here the whole day talking.
Of course.
Yeah.
No, Dr. Tshuma, thank you so much for coming through, and thank you so much for that very educative information. Yeah. Well, you've heard for yourselves. It's a corporate responsibility. It's not just for the health practitioners to ensure that there is reproductive health care for the women. It's a responsibility for all of us to ensure that women have rights, justice when it comes to health care. We've come to the end of this special program. My name is Juliet Mutale saying, join us next time for another exciting episode. Bye-bye.